enhancing the quality of your life. That is what Action Spine and Joint is all about. We got Dr. Casey Bearden here. We're talking about the conservative approach to spinal decompression, and it is a great way to avoid back surgery, which most people do not want to do. It is good to see you.
Thank you. Thanks for having me.
Okay, first of all, what is spinal decompression and how you do it differently?
Yeah, so spinal decompression has become a buzzword for so many chronic neck and back pain sufferers because it's so widely used now and considered mainstream because we have so much clinical-based, evidence-based research that we just didn't have 30 or 40 years ago. And basically there's two types of spinal decompression. One is what we call open decompression, and that's your back surgery. Number two is what we call closed decompression, and that's what we do in the clinic. And it's more the conservative approach. We call bloodless surgery.
All right, I like that.
No knives, no needles, no downtime, no pain at all, no side effects, and more importantly, no chemical addiction. Most people, after 5 minutes after a normal, very safe and comfortable type of procedure, they're back to doing their normal daily activities. And it's really probably the safest, most effective type of spinal procedure that you can have done.
Truly, people come in on their lunch hour just to get treatment, right? Incredible. Okay, so you wrote a book about it. I know you've got years of experience. Talk about that.
Yeah, so the book is called Getting You Back into Action and Keeping You Off the Surgical Table. I wrote that book many years ago, and it's basically a book with a synopsis of our protocol. It's a very unique protocol that we've established in the clinic, and it's called SMART Spinal Decompression. The SMART stands for Spinal Molding and Remodeling Therapy. And basically what that is a combination of different modalities that we bring together to not only decompress the pressure off of the damaged spinal joints and the nerves and the ligaments, but also we bring in a proprietary method of re-strengthening and rebalancing the core and the posture muscles that hold you upright. And this allows us to kind of reinforce long-term correction so that it doesn't continue to reoccur over and over again. And then we bring in a deep tissue laser, which brings down inflammation. It penetrates 7 centimeters deep into those spinal joints that are so damaged and inflamed, increases energy to those tissues, and anything with more energy is going to heal much faster and more long-term instead of just a Band-Aid temporary effect.
It's been incredible, the success that you've seen. Let's talk about who this would apply to. You know, what symptoms would you have when you say, you know what, maybe I need to take action?
Good question. Basically, anyone with reoccurring spinal stiffness or much less any kind of chronic pain, any kind of sciatic discomfort, numbness down to the legs or even the arms for that matter. You can have the same thing in the neck. Basically, if you're having these kind of conditions now, they're going to get worse before they get better, and they're going to get more expensive long term, not cheaper. And so, I mean, even with that said, you can't really. You can turn back the hands of time. Sometimes there's water under the bridge, there's damage is done, but you can still avoid chronic pain, epidural steroids, and back surgery.
Right. I mean, don't live in pain anymore. I know you've got an offer to help people kind of get through the door and take that first step to getting well.
You know, we have a 90% success rate with these conditions, keeping people out of the surgical suite and away from the chronic addictive opioids. And so what we've done is, for viewers of the station, we've created 25 slots on our treatment over the course of the next 30 days. We're a very busy practice. We see a lot of patients, but this allows the prospective patient to come in with any imaging you've had done recently, and allows us to do a comprehensive review and screening of your situation. And we'll actually include the initial treatment with that, a trial treatment, just to determine your level of candidacy for our protocols, and see if you really qualify to move to that next stage. And we're doing this at a $200 savings for just $47.
Yeah, under $50 to not live in pain anymore. Get started today. Yep. NashvilleSpineDoctor.com. It's NashvilleSpineDR.com to learn more. Action Spine and Joint. It's so good to see you.
Thank you for having me.
You're watching Today in Nashville.